As the name suggests, in orotic aciduria, there is increased urinary excretion of orotic acid. What is orotic acid? This is an organic acid. That means it has carbon. Look at the structure. There is no need to memorize. Can you recognize this structure? What is this? This is pyrimidine ring, right? So there are two ketone groups. So this is pyrimidine dione and there is a carboxylic acid. So orotic acid is a pyrimidine dione and a carboxylic acid. What is the role of orotic acid in human body? This is an intermediate in the de novo pyrimidine biosynthesis. See, this has pyrimidine ring. We just need to remove this COOH group and we have to add ribose and phosphate. Then we will get nucleotide, right? Which is the first nucleotide produced during de novo purine biosynthesis. Can you tell me what is that? That is your IMP, inosine monophosphate. From that we synthesize AMP and GMP, right? What about pyrimidine biosynthesis? The first pyrimidine nucleotide to be synthesized is your OMP. So how are we going to produce OMP? Let us discuss. So look at this. Orotic acid, as we have seen, this has a pyrimidine ring. We just need to add ribose and phosphate. We cannot just add a ribose 5-phosphate. Instead of ribose 5-phosphate, what are we adding? We are adding phosphoribosyl pyrophosphate because this is more activated compared to ribose 5-phosphate, right? So PRPP we are adding. From PRPP we are going to just transfer ribose and phosphate. Phosphoribosyl transferase. The enzyme name is very easy. See, orotate phosphoribosyl transferase. That means we are going to transfer phosphoribose to orotic acid. So there is release of inorganic pyrophosphate. PP means pyrophosphate. What happens to this PP, inorganic pyrophosphate? This is acted upon by an enzyme called pyrophosphatase in the human body and it will release inorganic phosphate. Remember this point also. So what do we get when we add ribose 5-phosphate to orotic acid? Of course, it is orotate monophosphate, OMP, the first pyrimidine nucleotide that is synthesized in the de novo pathway. But look at this. So there is a COOH group. We need to remove this COOH group. So the next enzyme is OMP decarboxylase. Remove the CO2. So now you get UMP. So from UMP we can produce TMP, right? So from DUMP we can produce DTMP. The name of the enzyme is thymidylate synthase, right? Okay. So if you look at this reaction, you are seeing two enzymes, orotate phosphoribosyl transferase and OMP decarboxylase. But these two enzymes are present in the same protein. Okay. So there are two activities. So orotate phosphoribosyl transferase and OMP decarboxylase. So these two enzymatic activities are present in the same protein. So this is collectively known as UMP synthase. What is it known as? UMP synthase. Remember. See, from orotic acid, what are we synthesizing? We are synthesizing UMP. So that is why this is UMP synthase. So UMP synthase is a bifunctional enzyme. If you want to know more about bifunctional enzyme, there is a video on active site of enzyme. There we have explained bifunctional enzyme very clearly. So please watch this video. So we have discussed how orotic acid is converted to UMP. Let us come back to the discussion of orotic aciduria. Orotic aciduria can be hereditary as well as acquired. First, let us discuss hereditary orotic aciduria. There are two types, type 1, type 2. In type 1, both the activities of the bifunctional enzymes, that is orotate phosphoribosyl transferase and OMP decarboxylase, both are defective. Whereas in case of type 2, the second activity, that is only OMP decarboxylase activity is defective. Okay. What is the inheritance of hereditary orotic aciduria? Unless mentioned, most of the metabolic disorders are autosomal recessive. Okay. So most are autosomal recessive. Right. So you should always remember those metabolic disorders which are autosomal dominant, those which are X-linked recessive. Okay. No need to memorize autosomal recessive disorders. In addition to the intrinsic defects in the pyrimidine biosynthesis pathway, orotic aciduria can also happen due to defect in urea cycle defect. How? Let us discuss. Look at this. This is the first and rate limiting step of urea cycle, which is happening inside the mitochondria. Ammonia and bicarbonate, they are condensing to form carbamyl phosphate, right? In the next step, carbamyl phosphate condense with ornithine to produce citrulline. The enzyme catalyzing this reaction is ornithine transcarbamylase. This enzyme is coded by X chromosome. Remember, always you should remember only the exceptions. So, OTC defect, that is hyperammonemia type 2, is inherited in X-linked recessive manner. In OTC defect, there is orotic aciduria. It's very easy to remember. OTC defect, orotic aciduria, right? So in type 2 hyperammonemia, you have orotic aciduria. Why? Because OTC is defective, carbamyl phosphate cannot combine with ornithine. So the level of carbamyl phosphate accumulates inside the mitochondria and it comes out to the cytosol. In cytosol, it can be acted upon by the enzymes of pyrimidine biosynthesis. So that leads to mild orotic aciduria. Alright, so this is very, very important. Why urea cycle defect can lead to orotic aciduria? If they ask you, just write this flow chart. In addition to this, orotic aciduria can also happen in Rye syndrome. So what is Rye syndrome? Ingestion of aspirin by children below 5 years during influenza like illness leads to Rye syndrome. So you should never give aspirin to children below 5 years, especially during flu like viral illness. Okay. So what happens in Rye syndrome? There is dysfunction of mitochondria. So that leads to leakage of carbamyl phosphate into the cytosol. So it's acted upon by pyrimidine biosynthesis enzymes and there is orotic aciduria. Okay. So Rye syndrome can also lead to orotic aciduria. So let us quickly summarize the etiological types of orotic aciduria. It can be hereditary as well as acquired. Hereditary type 1, type 2. Type 1 means both the activities of bifunctional enzyme are affected. In type 2, only the second activity is affected. Urea cycle defect, especially ornithine transcarbamylase deficiency, that is hyperammonemia type 2 will lead to orotic aciduria. This is hereditary. What about acquired? Certain drugs like allopurinol, 5-fluorouracil can also lead to orotic aciduria, as well as ingestion of aspirin during viral illness by children can also lead to orotic aciduria. So this is all about the etiology. What about the pathogenesis? Let us try to understand the biochemical basis of clinical features first. What is defective in orotic aciduria? Orotic acid cannot be converted to UMP, right? UMP synthase enzyme is defective. If UMP cannot be produced, there is no conversion of DUMP2 to DTMP. So what will happen ultimately? DNA synthesis will be affected. So if DNA synthesis is affected, it will mostly affect the rapidly proliferating tissues like bone marrow. So that is why orotic aciduria leads to megaloblastic anemia. So this is the clinical feature of orotic aciduria, megaloblastic anemia. You know, folate deficiency leads to megaloblastic anemia. Vitamin B12 deficiency will cause folate trap. That is why it causes megaloblastic anemia. So even if you give folate and B12 in orotic aciduria, it will not respond because DUMP to DTMP conversion cannot happen because DUMP is not produced. So the treatment is giving oral uridine. So give oral uridine as a treatment in this disorder, right? Finally, let us complete this video by understanding how to differentiate orotic aciduria due to urea cycle defect and UMP synthase defect. Look at this. Hyperammonemia present and megaloblastic anemia absent. That means, what is this? This is urea cycle defect, right? What about this hyperammonemia absent? Megaloblastic anemia is present. That means this is UMP synthase defect. Very simple. So that is all about orotic aciduria. So we have discussed what is orotic acid, what is the reaction catalyzed by UMP synthase, what are the types of orotic aciduria, what is the biochemical basis of megaloblastic anemia, right? So we have discussed so many important points. If you have found this video useful, please share this video with your friends. Thank you. Happy learning.